recent survey found roughly a quarter of people in the world say they're feeling lonely, even when surrounded by other people. Loneliness is a state of feeling you're at the edge of society, unable to easily talk or relate to others. And it can have huge implications.
The World Health Organization has declared loneliness a pressing public health threat across all age groups. Studies show it's as bad for you as smoking and obesity, raising your risk of anxiety, depression, heart disease, dementia, and early death. So why are people feeling so lonely, and what can be done to fix it?
You can be connected, communicating with a lot of people, but not have a connection. So the way you know you feel lonely is it hurts.
Dr. Jacques Lee is an emergency room doctor at Mount Sinai Hospital in Toronto. He's seen firsthand the devastating impacts of social isolation, having too few social contacts, and loneliness on his patients during the pandemic. He's now studying ways to reconnect people, but adds it's not a new problem.
It was always there. It was there before COVID.
Scientists say the quality of our in-person interactions have been deteriorating for decades. Take this example. You probably remember a time when you picked up the phone and called someone to wish them happy birthday. Then, many of us switched to sending a text message. Now, it might just be a post on a social media wall that says HBD. Experts insist the quality of our interactions need to be more meaningful.
There's a huge long list of things that can work, and I think what it is coming up with something that's easy to start, that's cost effective, and that's scalable.
I think they actually saved my life.
After a bad fall landed her in hospital, Elaine Daw was asked to take part in one of Dr. Lee's loneliness trials.
I was going down a very serious rabbit hole of depression, sadness.
In the years following a sudden job loss, Daw says she lost confidence in herself. A once vibrant life full of friends and gatherings slowly grew dark.
It just seemed I was running out of runway, and I was trying to deal with aging.
Then a box arrived from Making Art, Making Change, filled with supplies and an opportunity.
I'd never painted before.
It connected her with a group of other patients. A space to learn, laugh, and cry together.
I love you guys. I want you to know that you've brought a lot of joy into my life, really.
In their final session, Dr. Lee dropped in to say thanks.
I'm already excited to hear these testimonials.
At the same time, he's overseeing another study, which includes Andrew Taylor, a volunteer at Mount Sinai Hospital.
Hi, can I help you?
I'm trying to find how to get to the NICU.
Based on age and shared interests, Taylor's part of a trial connecting hospital volunteers with recently discharged patients.
Patients who are assigned to volunteers, such as myself, are given an iPad like this on loan with a preloaded app called A Touch Away. It makes it very easy for them to connect with us during the weekly video calls.
Taylor calls a patient at an agreed-upon time over 12 weeks to talk about everything from sports and cars to travel. The trial isn't over yet, but we asked Taylor, how's it going?
It's good, and to the point where I kind of wish it didn't end. I live alone too, and so I get as much out of it, I think, as some of the patients.
Scientists say that makes perfect sense.
Lonely people have very distinct brain variations compared to non-lonely people.
Kimia Shafke studies our brain on loneliness at McGill. Part of her research shows loneliness lights up default networks in the brain, often used to ruminate about people and the past and imagine social interactions.
Social interactions are at a core of who we are and what distinguishes us from other species. Our ability to work together and communicate and pass on knowledge is really intricate and very important to how we coexist.
Considering what's at stake, Dr. Lee says physicians need to start asking patients whether they feel lonely. He hopes results from his studies can one day offer new tools for combating loneliness.
If we don't treat an important social determinant of health, outcomes are going to be bad, and we're not going to be able to afford to take care of people.
Daw is now reconnecting with old friends and making new plans.
I came to the conclusion, and it took me 75 years, the conclusion that I am enough. It was the first time in my life.
Hello.
Hi, Eva. How are you today?
She says it's not always easy, but she now understands she's truly not alone.
I'm looking forward to talking to you and seeing how your life turned out.